Hey everyone, welcome to another episode at the Hormone Optimization Masterclass here at Rebel Health. I'm your host, Michael, and in this episode, I am joined by Ina Toppler. Ina, welcome.
Thank you so much. I'm so happy to be here, Michael.
Yeah, it's going to be fun. This is a topic that we get asked about a lot, and this is a topic in a hormone optimization masterclass that needs to be covered. And it's one of the most common sources of hormonal challenge and frustration for people. So, we're going to be talking about the thyroid. And before we get into thyroid health and thyroid hormones, I'm just going to introduce Ina real quick, and then I'll get out of the way and let her do her thing. But you're in for a treat. Ina Toppler is a board certified clinical nutritionist with over 19 years of experience in clinical practice. She's the founder of Complete Nutrition and Wellness and Integrative Practice, the host of Thyroid Mystery Solved, Hashimoto's and Hypothyroidism Revealed podcast, and the educator behind the Thyroid Mystery Solved step-by-step program. As a health detective, educator, thinker outside the box, and Hashimoto's rebel, Ina loves getting to the root of hypothyroidism and Hashimoto's and has helped tens of thousands optimize their thyroid health and support their immune systems. She knows you're struggling, and she's here to tell you that you're not alone and show you as many answers as she can starting now. And we'll have links to website and social media. She's on Instagram, but we'll put the links where you can click them. Her website's inatoppler.com. So the floor is yours.
Well, thank you so much for that introduction. I'm just going to share my screen, and I'm so excited to talk about thyroid because, like you said, thyroid hormone is a very important hormone. So often we think of hormones that are estrogen or progesterone or testosterone, but thyroid is so important, and it literally controls everything in the body. As we were saying, it's very important to get our thyroid right, but before we do that, we also have to understand how the thyroid works and how we find out if there's even something wrong. Because so often people are told, oh, yeah, you're tired. Yeah, you're gaining weight. Yeah, you have brain fog. Yes, you have inflammation. Yeah, your hair is falling out, but you must be stressed. Now, not to say that stress isn't important. Of course it is, but there's so much more that we need to look at. And what's really important for us to know is our thyroid literally controls everything. And we need thyroid hormone from our head to our toe. And I mean that very literally. And when we don't have enough thyroid hormone, or if that thyroid hormone is not properly being utilized or absorbed, we can have a lot of different issues. So for example, weight gain, such a big thing that so many people struggle with, whether it's 5 pounds or 50 pounds, right? And sometimes people try eating less, they exercise more, and it's like nothing is working. Well, the thyroid is going to control what happens with our metabolism, right? It regulates metabolism. It also regulates our temperature, which is really, really important. And that is going to affect our metabolism too. So if our thyroid is off even a little bit, it's going to be much, much harder to lose weight. Thyroid also has a big effect on energy. How often do people say, oh my gosh, I'm just tired? Maybe I'm tired all day. Maybe I'm tired after a certain time of day. And, so often it's chalked up to, okay, well, you're doing a lot, right? You have little kids or you're working and all that. I get that. But people always know, like, no, there's something else happening. And the thyroid controls that because it regulates our energy. And we need that for all of our cells. Hair is another big symptom when we have thyroid issues. And of course, yes, there's certain nutrients that affect hair like B12 or iron, and we need those. But thyroid has such a big control over hair. Sometimes you could take vitamins until they're literally coming out of your nose and it's not helpful, right? You still have a lot of hair loss. So we have to get the thyroid right there. Nails, another big thing, nails that are brittle, nails that chip, nails that break a lot, dry nails. Really, the thyroid has such a big effect on that. The other thing that's really important that a lot of people don't think about is the liver and the gallbladder. So the liver is actually controlled by the thyroid too. Our liver is our main detoxification organ, and it's really important that we detoxify properly because we're exposed to so many toxins literally every single day. There's so many toxins from our air or food or water, right? And when we don't detoxify properly, our cells get filled with toxins. We become more sluggish. That can actually cause weight gain because what's interesting is that the body's actually going to store toxins inside our fat cells. And so when you try to do things like exercise or eat better to let go of fat, the body's so smart, it's going to say, I'm not going to let go of these fat cells because there's toxins in there, because it knows that if the toxins come out, that you're going to become more toxic if it gets into the bloodstream. And so that's why it's so important for the liver to work. And people often say, oh, well, I'm just going to do a liver cleanse. Great. But here's the thing. A liver cleanse is very helpful. I'm never against that. But we have to remember what's at the top of that, what's at the core, the thyroid, because it controls the liver. So you could cleanse your liver, but then if the thyroid isn't stimulating and supporting the liver properly, it's going to become more sluggish, and you're often going to have a lot of different symptoms. And then gallbladder is another connection with thyroid. Gallbladder is what helps us to process our fat soluble vitamins like A, D, K, and E. It helps us to digest fats better. And that's really important for overall digestion, but also for our metabolism, for our energy. And so if our thyroid is not functioning well, the gallbladder is going to become off. And from that, there's also a connection with cholesterol. So often when people have thyroid issues, and when I say thyroid issues, we'll talk about that in a couple of minutes, but it's not necessarily where it shows up in very basic blood work. We need to look a little bit further. But if the thyroid isn't optimal, because of its effect on both liver and gallbladder, it can make your cholesterol be higher. And obviously, of course, there's diet changes, there's even medicines out there, but the liver controls that and the thyroid controls the liver. So that's a really important connection then that a lot of people don't realize. Now, the other thing that is affected by thyroid is leaky gut. So in the functional medicine space, a lot of people have heard about leaky gut. And if you have not heard about leaky gut, essentially it's the gut lining that becomes leaky, meaning that there's tiny little microscopic holes that form in the gut lining. And the problem with that is that foods get in, as food comes in, it's supposed to break down to very, very small particles. But if it doesn't break down properly, some of the bigger particles can seep out through those holes, and that could cause a lot of inflammation. It could cause digestive issues. It can cause food sensitivities. And so often people talk about, okay, great, well, let me do a leaky gut diet, or let me take supplements like glutamine, which is a really big one for leaky gut, or let me drink bone broth, right? Great. Well, those things can be helpful. However, the thyroid actually supports the membranes in our body. And one of the big membranes is the membrane around the gut. So if your thyroid isn't optimal, you could be doing stuff to heal the gut. You could be eating well. You could be doing all the right things. And yet the gut may heal for a minute, right? And then break back down because the thyroid isn't optimal. And it's this vicious cycle. It's like chasing your own tail. So it's really, really important. And of course, when there's leaky gut, there's more digestion issues, but there's also digestive issues from just directly having a slower thyroid, because that can cause constipation. And then when there's constipation, obviously, in addition to the fact that it's very uncomfortable, toxins can build up because they're not coming out. And then it's this double whammy with that. A big connection with brain too, because just like we have a membrane around the gut, we also have a membrane around our brain. And so when the thyroid isn't optimal and it's not supporting the membranes properly, the membrane can become leaky around the brain too. And that's your blood-brain barrier. And so when we talk about leaky brain, it's like brain fog, fuzziness, confusion, memory issues, all of those things can be due to that. So things that shouldn't get into the brain can, because that membrane is more leaky. And again, the thyroid controls membranes. So we have to make sure we have optimal thyroid hormone. And there's a big connection with mood as well. Because again, like our neurotransmitters that are made in the gut, a lot of that function is controlled by the thyroid. And of course, there's so many different things we could do for mood, from supplements to food changes to lifestyle changes to, of course, even medication as needed. But we always have to look and see, well, is the thyroid optimal, right? Because this is that big missing link for a lot of people, and they don't always link it to mood. Often people link it to just energy and weight loss. They don't think about thyroid from all of these other angles, but it's so, so important. And so when we have a slow thyroid, that actually means that we don't have enough thyroid hormone. And so we want to look and see, okay, well, why is that the case? Well, so 85% of hypothyroidism, and some people actually say it's even higher than that. I put 85 here, but I would say 85% plus cases of hypothyroidism or a slow thyroid is actually caused by Hashimoto's. So for those that may not be familiar, Hashimoto's is an autoimmune disease where the thyroid is being attacked by the immune system. And it's not a one size fits all approach because there's a lot of nuances to it. And I'm not saying every single person with hypothyroidism has Hashimoto's, but a lot of people do. What's interesting is that Hashimoto's is not always tested, or at least not right away. So oftentimes people may get the hypothyroidism diagnosis or that something is going on with their thyroid, but they don't find out they have Hashimoto's until years later. But this is so important because it's not the thyroid's fault it's being attacked. The thyroid is really just an innocent bystander, right? It's the immune system that got confused and started to think that your thyroid is not your friend and started to attack it. So when we try to address thyroid, we really have to look at it from two angles. We have to look at it from the Hashimoto's piece. First, we need to make sure we know if we have Hashimoto's or not, so we can address that and then address the thyroid. Now, for those that may not be familiar, the way that we know if someone has Hashimoto's is if they have thyroid antibodies. So there's two specific antibodies as related to Hashimoto's, and that is the TPO antibody or the thyroid peroxidase antibody or the thyroglobulin antibody. And if you have one or the other that's elevated above the lab's reference range, that is how your provider would make the Hashimoto's diagnosis. And it's one of those things where it doesn't matter which it is. One is not better or worse than the other. And sometimes it's both. But if you have at least one above the lab's reference range, that is how your provider would diagnose Hashimoto's. And so from there, we want to kind of think about, okay, the thyroid is being attacked. So typically in a very conventional setting, a lot of providers will just support the thyroid. That's important, right? But if the thyroid is being attacked by the immune system, we have to make sure that we're supporting the immune system so that we can halt, right, stop, or at least reduce that attack, or else the thyroids continue to get attacked, right? And then we support the thyroid, it gets attacked more. We support it and it gets attacked more. It's just also this like chasing your own tail situation. So we want to think about, why is it that the immune system is confused and why is it attacking the thyroid in the first place? Oh, and this is just a slide just showing that we have the immune system attack, we have the increased inflammation from that, and then we get thyroid destruction in the middle, which we don't want, right? We want to preserve our thyroid. So why does the immune system start to attack the thyroid? Well, it's because of what I call triggers. Now, there are many, many, many different types of triggers, and they're going to be individual for people. However, these triggers can go into four main categories. So we have our food trigger, infections trigger, a toxin trigger bucket, and the stress. And so when we look at food, this is going to be essentially anything that you're eating that your body doesn't like. Gluten is definitely a big one. A lot of people with Hashimoto's and other autoimmune disease can be sensitive to gluten, but it could be other things. It could be dairy, it could be corn, it could be even broccoli for some people. And it's really important that we look at food sensitivity testing, we look at genetics just to see. And there's a process that's called molecular mimicry. So it's when the body attacks something and then because the structure of whatever that is has similarity to your organs, even just a small similarity, it can then cross-react and attack. And so for gluten, for example, there is a little bit of similarity between some molecules on gluten to some of the molecules on thyroid. It's not identical, but there's some similarity. And so when you don't process gluten well and you eat it, the body attacks the gluten and then it could accidentally attack the thyroid, confusing that. And that also can happen with other organs as well, but specifically with Hashimoto's, it's going to be the thyroid. When we talk about infections, these aren't necessarily things like the common cold, but they're more chronic infections. So things like Epstein-Barr virus, COVID, especially long COVID, but also bacteria like H. pylori, which is a bacteria that's in the gut, parasites, Candida, which is a type of yeast, other bacteria that can create dysbiosis. And the reason this is an issue is because these infections are typically chronic and just under the surface. And so the immune system is constantly trying to get at them, but it can't, right? So imagine working really hard for weeks and weeks and months, even years, and it's like you're doing, and you just can't do it anymore. You get tired out. So it's the same thing here. The immune system literally just gets so tired. And it's like if you haven't slept in 3 nights, sometimes you don't even know what you're doing. You put your keys in a refrigerator by accident, right? It's the same situation. The immune system gets so tired from lack of sort of sleep, so to speak, and rest, and it can actually start to get confused and it becomes very hypervigilant. So it's sort of that let me shoot first, ask later situation. And that's why infections could be such triggers. And then our third bucket is toxins. So these are things like molds, heavy metals, in heavy metals, we're talking about things like mercury, which has a specific affinity to thyroid, aluminum, lead. And, a lot of people think, oh my gosh, metals, that's such a big deal. Like it must take a really long time to, resolve that, but not necessarily. A lot of the people that I work with, it could be 1 to 2 months to address that. The key is really that you're addressing it specifically for you. And you're doing it in the proper order for you. And that's when it's not that difficult. It's just we have to get really specific with it. Obviously in toxins also we have the different herbicides and pesticides in our food and our water and just the different chemicals in our personal care products or cleaning products. All of that will fit into this toxin category. And like we talked about with the liver before, if the liver is overburdened, the whole body becomes overburdened, and that puts stress on the immune system, which creates it to become more confused. And then lastly, but not least in any way, is the stress bucket. And what's important to remember here is that stress can be both emotional and physical. And oftentimes when people talk about emotional stress, people say, oh my gosh, you don't know my life. I have so much going on. I can't do anything about it. I get it, right? Sometimes there's certain things we can't change, but there's a lot of things we can. Our reaction to the stress, or even stressors that come not maybe in like big forms like a financial stressor or a job that maybe someone doesn't like, but it could be things like having certain negative thoughts, right? We have our thoughts every second of the day. Shifting that is easier than maybe changing a job you don't like, and it makes a big difference. Also, what I see a lot with people with thyroid issues and Hashimoto specifically is these sort of patterns of being a people pleaser or being a perfectionist, right? So if you're someone who says yes, even though you mean no, or you do things because you think you should, right? Not because you really want to, or you feel bad about really saying something because you don't want to hurt someone's feelings, right? It happens to all of us, but I think with some people they're just those patterns, we see them a little bit more. That creates a lot of stress. And there's a lot of things I actually work through, a lot of different formulas in my programs to help people to identify these underlying beliefs and where that comes from so we could shift it. And shifting that can take out a whole bunch of that emotional stress, even if you can't at this moment make a change with your living arrangement or your job or wherever it may be. And then the other side of stress is the physical piece of it. So if we have infections, or we have foods we're eating that our body doesn't like, or, maybe our blood sugar isn't properly regulated. Blood sugar dysregulation is a huge physical stress on the body. So addressing some of these other buckets can actually help with the physical part of the stress. And so when we address our individual triggers, that is how we can get that immune system to calm down and slow down. And in a lot of cases, even stop that attack on the thyroid. But it is important to keep in mind that these are going to be somewhat individual. And we do want to make sure that we're addressing them in the right order. Because sometimes if you address one thing, but the other needed to be addressed first, it's not going to work as well or as quickly. People often tell me, oh my gosh, I've been at it for 3 years. Like, I don't have 3 more years, right? And I always tell them, no, like when we do things in the right order for you based on what you have versus like literally throwing everything under the kitchen sink, at them, it works so much better and so much quicker as well. So that is the immune system part. So that's kind of leg number 1 of supporting thyroid issues with Hashimoto's. And then the other part is that we want to support the thyroid itself, but we want to really support it specifically for each person. And that's not just generally taking one medication, because we have a lot of different medications. There's a lot of different supplements, a lot of different diets out there. And it's going to really vary from person to person. So what I'm going to do is I'm going to share another screen just to show you a little bit about how thyroid works. And I promise it's going to be in layman's terms. I'm going to make it super simple to understand. I don't want to get too scientific, but I think it's important for people to see what happens with the thyroid and why thyroid is so much more than just TSH. Because so often when we go to the doctor and we suspect a thyroid issue, they'll say, oh, your TSH is fine. Nothing is wrong. Or they'll say, oh, your TSH is high. Okay. Yes. So you have hypothyroidism. Here's some medicine and I'll see you in 6 months. Right? But they don't look at a lot of the other nuances that are really, really, really important to look at. So basically, and I promise this is going to be super simple. I just want to show what happens as the thyroid hormone is produced so you could see the different things, because then that's going to help us to see which part of the thyroid may not be working. So first, what happens is our brain, specifically our pituitary gland, is going to stimulate the thyroid, and it's going to do it via the hormone TSH. Most people have heard about TSH, and a lot of providers, they say TSH, that's it, nothing else matters. But let me show you why so much more matters than that. So once TSH is produced, it's going to stimulate the thyroid, and the thyroid is going to produce two hormones, T4 and T3. T3 is the active hormone that does all the good things that you need for your thyroid. Notice though how T4 is kind of bigger here, T3 is smaller. So people often say, I don't understand. Why in the world would our body produce so little T3 if it's active? And why does it produce T4 in such high amounts? Well, we need thyroid hormone for every cell in our body, like we talked about, from our head to our toe. So if we produce the T3 right here in the thyroid, it'd be used by the cells right here, and then we wouldn't have enough to go to the rest of the body. So our body's so smart. It takes the T4 with that little bit of T3, and it actually takes it to different areas of the body where it converts. And hormones, I always tell people, they're like children. You can't just let a child roam around on their own, right? You have to chaperone them. So it's the same thing with hormones. Hormones they travel on proteins, but for the sake of this example, we'll just kind of show that they travel on these buses. So these hormones get on the bus is then going to take them to the liver, and it's going to take them to the gut, where they're going to convert from T4 to T3. Now, there's a bunch of other steps that happen here too. I don't want to confuse it too much with the science. There's reverse T3, there's other stuff, but just for the sake of this example, think of it as that we get our active T3, or hopefully, right, get our active T3 from the T4 in the liver and the gut. And then once we convert and hopefully have a good amount of T3 converted, it gets back on the bus, and then the bus starts driving around the body looking for cells that need hormones. Once it gets to the cell here, the hormones need to do a couple of things. They first need to jump off the bus. They then need to knock on the cell. So basically, and the receptor say, hey, do you need us? And the cell has to say, yes, I do. And then they have to get into the cell. So from here, I think that you will be able to see that thyroid is so much more than TSH, because it has to stimulate the thyroid, then it has to convert to the active hormone. It has to get to the cell, get off the bus, and get into the cell. And so one of the things that I talk a lot about in my programs and really support people on is really working on knowing your thyroid type, and then making sure that you're supporting your thyroid for your type. And so what a type is essentially is a type of slowdown that someone has, right? And so it's basically looking at where the breaks are in here. Like, is it happening here where this support is not happening? Is it happening in the production? Is it happening in the conversion where this is not happening? Is it happening where the cells can't travel, or where they can't get off the bus, or where they can't get into the cell? So the different thyroid types are essentially where these breaks happen. And it's really, really important for us to figure that out. And, so often people will say, oh, I have a normal TSH. It's fine, right? But there's actually 3 different thyroid types that can have a normal TSH. Like one of my members, for example, her name is Linda. She went to her doctor and they told her everything's fine. It's not a problem. All they tested was TSH and T4. When we looked into it further within the program, we saw she had very low T3. So she wasn't converting. So she was this low T3 type. And so what we did for Linda is we did a very specific type of diet that's for this type. And then there's 3 specific nutrients that I used for Linda that are very different than people with other types. And that's how she was able to lose weight and have better energy. And then, just to give you another example, Allison, when she went to her doctor, they said, no, everything is fine. Your TSH is fine. And what was interesting is they tested her T4 and also T3. T3 is not often tested. You have to pull teeth literally to get T3 tested. They tested it. It was fine. And she's like, well, nothing is going on. And I said, well, hold on a minute. And so in the program, we looked at what was happening with her. And while TSH and T4 were okay, the issue with her was that her buses were driving around. And when they would get to the cell, they didn't open their doors. So she had all this hormone on the bus that was converted, ready to go, but the buses wouldn't open their doors, so to speak, meaning the hormones didn't want to jump off their proteins and couldn't get into the cell. So she was what I call the unavailable thyroid type, where she had the hormones, but they literally weren't available to her cells. And what's interesting about that is she had very similar symptoms to Linda. But totally different reason. If she did what Linda did, it wouldn't have worked. The medicine wouldn't work. And more medicine for Allison wasn't really the issue, because if she just increased her thyroid medicine, she would have even more hormones on the bus. They still wouldn't be getting off. And so for her, it was really looking at other hormones and other ratios and seeing why that was happening, which has to do with a lot of other hormones in the body. There was also, think of a couple other examples. There was also Tara. So what's interesting with Tara is she actually, everything here was perfect. She had normal TSH, normal T4, normal T3. Her buses were driving. They were opening their doors. Everything was getting into the cell. Everything was great. And then in her case, though, she had really high antibodies. The other ladies do too. But in her case, her actual thyroid was functioning, but her antibodies were high. And so for her, what was really important is her thyroid hasn't been destroyed just yet, but we needed to stop that immune attack so that we could prevent more destruction. And what's really interesting in Tara's case is that, her doctor just said, oh, well, your thyroid's fine. Yeah, you have Hashimoto's, but it doesn't matter. Antibodies don't really matter. Just do whatever. Like, you don't have to do anything. And then eventually your thyroid is going to get destroyed. And then we'll give you medicine, which is what I was told years and years ago. And that doesn't make any sense. Why would we wait? Right? When we can support it now. And also what's interesting about symptoms is Tara has, she was gaining weight. She was really tired. She had brain fog. She had all the symptoms. And a lot of people don't realize that even if thyroid function is normal so far, the inflammation that's created from the immune system doing its attack on the thyroid, that inflammation can be all over the body, not just in the thyroid. So all of those symptoms can be coming from the inflammation, which is what the antibodies are showing us that there is. So even if thyroid looks perfect, so to speak, right, that the symptoms could still be coming from that. And then another really common one that I see, and I think a lot of people have probably experienced in the past, is the high TSH thyroid type. And usually when TSH is high, it's a pretty clear-cut case. The provider usually says, oh, yes, you have hypothyroidism, here's medicine for you. What's interesting to note here is that, and I've seen this so often with thousands of people in my programs and my practice, is that there's different subtypes of TSH. So if you have a high TSH, but your hormones, thyroid hormones, are normal, that means one thing. If you have a high TSH and your thyroid hormones are low, that means something else. And medicine may be needed for one of the subtypes, but it may not be needed for the other. And a lot of times people ask me also, hey, I'm on medicine. Can I ever get off? And so that actually depends on your subtype, because some subtypes absolutely can get off, whereas other subtypes, if there's already a lot of destruction, they may not. So it's a case by case basis, but that's why, again, it's so important to really know where the breakdown is and what's happening. There's just so much more to thyroid than TSH. And so to be able to figure out the thyroid type, we need a full thyroid panel. And a full thyroid panel is going to be the TSH. It's going to be our total T4 and total T3, free T4, free T3, reverse T3, T3 uptake, and thyroid antibodies. And I know that oftentimes it's hard for them to get a full thyroid panel. So this is something you want to bring to your doctor and ask. You can even get it on your own if need be in a lot of places, especially in the US. And from that is where we can analyze it and figure out what the type is and then support it. And so often people tell me like, oh, like I can't get it from my doctor, but then they get it on their own. But then they're like, well, I don't know what to do about it. And so of course we help them with that. I feel like I'm sort of like this math scientist, if you will, with, because I look at these all day long, every day, like all the time. And so I can see the patterns really quickly. Sometimes, it takes a little bit for people to understand that, but that's something I could see really quickly. And, I can help them with that, but that's really, really important. And so I'm just going to reshare my screen one more time to my other presentation here and show you one other thing here. And that is that when people are dealing with symptoms, and symptoms could be, like I said, anything from sluggishness to weight gain to brain fog to inflammation to joint pain to hair loss to dry skin, right? And they're like, well, why, I'm doing all the right things. Why are things not happening? Well, there's two reasons. The thyroid support is going to be too general, meaning that they're not supporting it for their type, or they're not addressing the immune system, right? Because we really, really, really need both. So it's this twofold approach to Hashimoto's. It's supporting the thyroid and then also balancing the immune system. And I have much more information on that on my website and with all of the different things that we do to help support that.
Well, thank you. That was super clear. I love the drawings and the school buses. I
Mhm.
think that people can get kind of frozen and overwhelmed with some of these topics as far as what to do. Maybe they bought a book and they read it and it was a little too in the weeds, or they listened to a biochemistry podcast or something and they're like, how could I ever figure this out? And thyroid, like, yeah, the biochemistry can be complex, but the gist of, how it's produced, where it's converted, what it needs to do, how it gets in the cell, like where the problems can be, I think is really simple to understand if presented in the right way. And I like that you mentioned that, there's these different types that might have the same symptoms or a very similar subset of symptoms, but the reason for their cells not having adequate activated thyroid hormone can be different. Is it not being signaled to be produced, or is it not being converted, or is it not getting in the cells? And like, it's really impossible to treat it, I'd say, efficiently, because you could guess right, or like certain things would help everything, but to do it really efficiently, and often without medication, you kind of got to know where the malfunction is. So I love the
Yeah, and
way.
even with medication, there's over 10 different thyroid medications, right?
Yeah.
So a lot of times people just say, here's Synthroid, right? Okay, well, that could work, but not if you are certain types where you may need a combination, one or two different ones, and then there's different ratios of the medication too, because a lot of the combination ones are in an 80-20 ratio, but some people may need a 90-10, so they may do better with compounding or doing them separately. And it's kind of knowing, where the breaks are and how much of it they need.
Yeah. And it's a it's a topic that a lot of women, especially, I know men have Hashimoto's and hypothyroidism too, but it more commonly affects women.
Yes.
I think kind of just get the TSH test. The doctor says you have hypothyroidism. Here's this pill. Go home. And they may or may not feel marginally better, but they don't think there's anything more to do. Like they did
Yeah.
the thing.
Unfortunately.
And there's so much more. And I like that you mentioned different forms of stress instead of just people either think one or the other usually. And the fact that our thoughts and the way that we think, like they think probably the only animal that can put itself into a stress state and keep itself there without any sort of like external situation going on that stresses us, and it can keep our physiology in a state of stress all the time. That's not observed in any other creatures. And so we've kind of gotten a little too smart for our own good in some ways, I think, and that ability to worry about stuff that hasn't happened or could happen or might happen or did happen or isn't happening right now. The story making machine in our brain contributes way more to these stress responses in the body than I think a lot of people realize. So I like
Yeah.
that you work on that with people and bring it up and talk about it. But yeah, I love the school buses and the drawings. And we'll have the links to your website, to anything else that people can contact you. And so I think that the first step is finding either someone to help you get it ordered or ordering for yourself a full test to really figure out what's going on.
Yes.
And then you can go from there. Come back, reference this video. But, she's got a lot of great resources too. But that would be the first step, because you can't really make efficient first steps beyond that if you don't really know what's going on. And it is such a massive gap in testing. I was shocked when I learned all this about, 10, 12 years ago, on how nobody ordered anything past the TSH. And then in a lot of ways, things have changed since then, not related to this, but like a lot of other things have kind of seemed to progress in a positive direction. And then I still hear all the time that people are diagnosed with only a TSH test, and it's like impossible to get anyone to order anything beyond TSH. And this is not like a secret how this works. This is not the physiology of thyroid hormone and conversion, and like everyone knows this. Like medical people definitely know this. Doctors know this. Everybody knows this. They know how that whole cascade works that you drew out. And I just find it dumbfounding that it's still done in that way. But
Yeah, well, here's the thing. I think when you say everyone knows this, I think like there's a caveat there, meaning like it's in the anatomy books, right? Like this is basic science, right? We're not like
yeah,
saying
or
some weird
could know
woo-woo
this, I
things,
guess,
right?
is what I
Could
should
know
say.
this, but I think the way it's taught
Hmm.
is TSH. It's basically, and here's the thing. I think back in the day, it might have been this way, right? Meaning that as long as your TSH is okay, we assume that the TSH is going to stimulate the thyroid properly. Then the thyroid is going to make the T4, it's going to convert, and all of the stuff is going to go, right? And maybe 100 years ago, before all the toxins were introduced, before we had so much stress, before all of the EMF and like everything else, right? Like it might have worked that way. Unfortunately, it doesn't in like half the population now. I mean, I'm guessing, don't quote me on half, but in a really large percentage of people with thyroid issues, just because I see this like all the time in my practice, like I see how many people have breaks in this one or that one, what the different thyroid types are. And so I think a lot of providers still go by like, oh, well, as long as TSH is fine, it should be okay, right? So they don't think, well, maybe it's not, right? But we see it's not so much more than we used to. And especially with Hashimoto's, it actually can break that conversion. And a lot of people don't realize that. But I've heard, I mean, Michael, the things I've heard from providers, a client would come and say, oh, my provider said T3 is not necessary. It's only necessary if you're in the hospital. I'm like, what? Like, where did they get that? Like, if you're in the hospital, like, well, only if you're really, really sick.
How would that even be relevant? Like that that's insane. Because that wouldn't.
Yeah.
There's very few emergency situations that someone's in a hospital where T3 would even be relevant to look
I
at.
know.
To
That's
figure out
I'm like,
what's
I don't
going
know
on
where
with
that
them.
came from,
Like,
but this was like a real quote. And then, I think just in terms of thyroid antibodies, right? People, sometimes, and I'll order labs for people if need be, but sometimes they'll go to their doctor and order. And the things that I hear people say is, oh, my doctor said antibodies aren't important. Why? Oh, they said it doesn't matter. They don't matter. They don't do anything. And it's like, yes, they do. Antibodies show there's an attack. Or they'll say, well, it doesn't matter if you have antibodies. You can't do anything about them anyway. And it's like, no, that's also not true. My antibodies at the height of my issues were over 10,000 for TPO. 10,000. I have them down to less than 200 now, completely in remission. And people that I work with have dropped antibodies by like 1,800 points in like a duration of 3 months, right? So like, yes, they matter. And yes, you could do something about that. But yes, some of the things we hear, it's like,
wow,
oh my
that's
gosh.
wild. Antibodies don't do anything. And it's not like you can have, like, your antibodies are still a positive test for Hashimoto's, yet you're in remission and you don't have symptoms. So it's not that antibodies being present alone does not mean that the attack and the damage is going to be happening. It means that it could if your body goes into like an inflammatory state of some kind.
Exactly. It has to do with the immune system's reactivity to them.
Yeah.
Because for some people, it's impossible to get them down to zero.
Yeah.
But again, it has to do with not the number, but it has to do with what the thyroid is actually doing or not doing, right? And if year after year, the thyroid is stable and there's no further destruction and there's ways to test that with specific tests and ultrasounds and things like that, that's how we would know.
And the whole thing about how you don't have Hashimoto's till a certain percentage of your thyroid is actually destroyed on an ultrasound, and then you have it, but you didn't have it before, and that's the diagnostic tool. I don't remember the percent or the ratio, but it's like a significant amount. It's a difficult amount to recover from. Like it's a heavily damaged. You have to have a heavily damaged thyroid before the conventional diagnosis is going to come in.
Yeah, and
Because,
I've heard
like,
things like that, and that doesn't mean it makes sense because typically it's the antibodies that is what gives a diagnosis, but yeah,
I've
some
had people that I worked with say my doctor won't give me anything until it reaches this point, and it's like, well, if you know the process is in progress, why? Anyways,
right, exactly.
why
But
just
again,
like let it go and be like, oh, we'll deal with
yeah.
it when you're really, really sick? It's like if somebody was bleeding out, you wouldn't be like, well, you could survive another 12 hours. We'll stitch this up like
Right,
in
right,
12
right. Yeah.
hours when you're dangerous. It's just,
Right. But the other thing too is, and there is, and especially, I mean, some states, but in outside the US also, a lot of providers don't give anything out. TSH goes up to 10 these days. So, but that I think is
10.
10. Yep. Even though the lab range is 4.5, a lot of times they
Yeah.
won't give till
Even
10.
4.5 is pretty
Yeah. Yeah. But
elevated.
here's the thing, even if they say, oh, I'll wait, it still doesn't address the Hashimoto's piece, right?
No, it doesn't
Because
even,
thyroid medicine is
no,
for the
they don't even
thyroid.
know. They
So,
don't even
but
look at it.
conventionally, and that's why, it's
Interesting.
programs like this that you put on and all of the information that
Yeah.
you offer here and on your podcast and things that we do that help to show people that, hey, like you could do, like, not that you even can, you should, right? Do stuff for the Hashimoto's piece, in addition to the thyroid, or else you're just going to be chasing your own tail.
Yeah, and what's cool is that your triggers that you talk about, the food triggers, infections, toxins, stress, we're talking about thyroid right now, and we're talking about Hashimoto's right now, but that applies to, that's been like a universal conglomerate of things that trigger most, well, any autoimmune conditions and most chronic disease states as a whole. So it's, the what to do is there, and it's not super complex, and so that's great. And so
Yeah.
that's like the easy part. And it's not that if you have this problem and this problem and this problem, there's this whole subset of things that you need to, like, I need to eat this way for this thing, and I need to lower my stress for this thing this way, and I need to avoid this toxin for this. And it's like, no, you could just do this as a blanket way to live, and you'd probably see a lot of benefits in, because we've done 5 of these master classes now. This is the one on hormones, but they've been on other topics, and that I've seen that little table of triggers in probably all of them. And so it's good it's not a temporary thing you have to do to fix something short term. It's a different way to live.
It's for everything.
Will lead you to just feel better overall. So thank you so much. This was fantastic. Everybody go check out her work, and she's got group situations and really helps people out with figuring out their type, and there's a lot there, and shares a ton on social media and free content and all of these things. So please go find Ina and her work. And any last thing you want to say?
Really just that if you're dealing with thyroid issues, there's always something that you can do, and to just not give up. A lot of times, if you haven't figured out your issues, it's likely because you haven't really addressed it comprehensively, but there's just so much there. And just to know that, like, you can explore that further, and there's so much that you can do.
Thank you.